India ranks third worldwide as a producer of drugs and pharmaceuticals by volume. But poor quality manufacturing and improper testing continue to pose a problem. The recent deaths of 5 young mothers at a Ballari hospital in Karnataka was only a fresh reminder of this. What does the episode say about the overall state of public healthcare in India? Are the existing drug regulatory laws enough to streamline the manufacture and supply of medicines in the country? How much power do states have in this process? Namaskara. Welcome to the first episode of Decode Karnataka for 2025. I'm Nalme Nachiyar. In the last few weeks, a series of maternal deaths in Ballari, allegedly due to contaminated drugs, has raised alarm over the quality of maternal care in the state. Between November 9th and 11th, of the 34 women who delivered through cesarean section at the Ballari district hospital, 5 died following complications. An expert committee concluded that the deaths occurred due to administering of a non-standard quality compound sodium lactate injection IP or Ringer's lactate solution. Many developments have followed since. Suspension of the Karnataka drug controller, blacklisting and initiation of prosecution against Paschim Banga Pharmaceuticals, manufacturer and supplier of the substandard IV fluid. A comprehensive audit of the 348 maternal deaths reported in Karnataka from April to November 2024, and announcement of 5 lakh compensation to the next of kin of the women. Meanwhile, a letter by the state government to the Drugs Controller General of India regarding the contradictory test results given by the Central Drugs Laboratory Kolkata and the Drugs Testing Laboratory Karnataka has also flagged issues with respect to drug testing and safety certifications in the country. For a detailed discussion on this incident, we are joined today by Dr. Shaibya Saldanha, a Bengaluru-based obstetrician and gynecologist. Hi, ma'am. Thank you for taking the time out of your incredibly busy schedule and joining us for the show today. Let me start off by saying that the maternal deaths in Ballari were what we could call an avoidable tragedy, especially since in a state of Karnataka, where the maternal mortality rate has significantly improved over the years. Like it's seen a decline from 83 per lakh live births in 2017-18 to 64 in 2023-24. So as someone who is so deeply invested in women's health, maternal health care, what do you think should be our takeaway from this episode overall?
Well, if you look at maternal deaths in general across the country and in our state, we do find that the deaths have reduced drastically, but now we have reached a plateau. We are not able to go down below that. And for that, the central government had started this process called the Maternal Death Surveillance Response Process.
Okay.
Now, this was something where every maternal death is to be investigated in detail to look at the entire process by independent doctors. The reason being that maternal deaths are almost 95% preventable. There are maybe 5% cases where it's very difficult, that they had a very complicated health problem previously or something else which has happened. But so for that reason, every maternal death has to be checked in. So sometimes what happens is when suddenly something like this happens, where suddenly there are a large number of deaths, we target one area. But it's very important to look at maternal deaths over a long-term process.
Okay.
So whenever suddenly something happens like this, we all get, there's a lot of drama and things like that. Committees are formed. There's a lot of need to investigate. But ultimately, these things take time because it takes time to go through the papers, the processes to see what exactly was the cause and to take action.
Okay.
And unfortunately, it just dies out. And we don't look at systematic ways of improving it. And that's what's really needed.
Okay. So you're saying we're focusing on only in this instance, it could be just the Ringer's lactate solution and not maybe other factors that could have influenced.
Yes. It's very important. And especially if you're looking at a place where you're talking of IV fluids being either contaminated or not of standard quality, these IV fluids are used for many other patients too.
Right.
So causes of death in other patients, we would have to look at, and these are important.
Okay. All right. In this case specifically, what was coming up again and again is the mismatch in test results by the Karnataka State Drug Testing Laboratory and the Central Drugs Laboratory in Kolkata on the quality of this IV fluid that was supplied. Is this an isolated case or does it happen often? And do we have like checks and balances, like a way to monitor this better?
So if you look at the way the drugs are manufactured, whenever a manufacturing company for medicines is started, there are a lot of processes and quality controls and inspections which are meant to be done. Every process, whether the raw material, how it is made, how it is packaged, has to be checked. And there are specific, SOPs for all of those, which have to be managed by the drug inspectors.
Okay.
Thereafter, the medicine is tested and it comes into different quality areas. Now, I just ask you as a question. Suppose blood pressure is being taken for a patient in two different instruments. One says it's normal, one says it's very high. Now, it's very important. I can't rely on just two. I cannot say, oh, it showed high on this instrument. This must be wrong. It must be the other one which is right. So I should have taken a third one, independent. And I would also check both my BP instruments, right? To see, because this is going to go on for other cases also. This is a case of life and death.
Correct.
So it's very important that whatever the process is used to test the drugs should be looked at. And if you look at drug testing, it is the way it's collected, the experience of the technician who's doing the testing, the reagents that they use, the temperature control in the lab. There are so many areas at which one can have a wrong report coming out. Okay. These all have to be tested on a regular basis. It should not be only when there is a mismatch in reports. Right. Because then we have to wonder, are all the other reports accurate or not? Right?
Oh, but, adding to that, the Karnataka government did say, as in that after these two tests, other tests have also been done. And there where one said NSQ, the other said SQ, like not so standard quality. So, so like you said, other tests have been done, but now what? Like now, which one to believe? Because the drugs have been withdrawn, but the damage has been done. So
absolutely. I think one of the biggest issues is not that we just sit and blame who did the wrong thing right now, but to look at overall how is our drug testing happening. I think you're aware that a couple of months ago, they found almost 50 plus drugs which are in the public health systems which were not functioning properly. They were either spurious or some of them were not actually up to the level that they should have been. So all these things have to be tested on a regular basis. They cannot be a knee-jerk reaction to an accident. I think we can value the deaths of these women and the lives of these women by taking the time to really create a very, very stringent system for drug testing and management.
Okay.
For example, in immunization, so we've realized that a lot of people are hesitant about immunization because there are adverse reactions. Whether a child has fever or sometimes a child may get convulsions, which has nothing to do with the immunization. So we have a very focused process called adverse effects following immunization.
Okay.
So anytime there is something like this, it has to be recorded by the healthcare worker and sent to the directorates to be taken action in.
Okay.
Because it was found that when we reduce those adverse effects, the people got immunized better because they were willing to, they were open to come forward for immunization. So the same way, one can have an adverse drug effect system, which is recorded regularly.
Okay.
Like I know that sometimes when I have been prescribing medication, there's a particular medicine which I found was not working.
Okay.
And I would be like, what is wrong with this? And if I found that
not working for that particular patient,
okay. Then I would see in two other patients also it's not worked. So then I would go and ask the pharmacy, what is happening here? Why is this not working?
Okay.
And if they were all three from the same group, I would probably say, or the same batch, I would say, I don't think I'm going to use this. I would tell the pharmacy, please don't keep this in your machine. But I've not really actually looked at the root of the matter. As a doctor, I'm not aware, most of us private practitioners or in public health system, doctors are not aware, where do I report if there's a problem?
Right.
Like normally they'll just tell somebody or they will tell the medical superintendent or they may tell somebody they know. But if it's a doctor in a primary healthcare center, they really don't know whom to talk to. So there is no system.
Okay.
Now that we have online systems so easily accessible, it would be great if you could have adverse drug reactions put in immediately and maybe you can prevent further deaths.
Like you're saying in some sort of a list or a form or something.
A simple form.
That goes to the medicine central authority?
Yes, to a drug authority, which immediately, because we know that, when it goes from primary health center to the community center to the district medical officer, then to the state, to the drugs office, a lot of this gets lost.
Right.
So, but if we had that across the country, and all the very simple, this is the name, age of the patient, this was what was the health problem the patient had, this was the batch number, and this is the medicines that were given, and sometimes there would be 3-4 medicines given, right? And these were the drug reactions which were given. Very simple, easy to fill. But when they come into a person who's watching only this at a central office, you're getting like 6 complaints about a particular type of medicine. Then action could be taken faster.
Okay. Which actually brings me to the other question that I had is the supply of spurious drugs, not of standard quality, substandard, fake medicines even. This is cropped up again and again. So, what are the regulatory mechanisms we have to keep this in check, and are they enough? Like you just mentioned about one, but overall about production, facility inspection, then testing, multiple, phases and stages. What we have, is it enough, or is there something more we can do?
So I think one of the issues with government across our country, and probably governments across the world, is this dislike of giving information to the public.
Okay.
Suppose we had that every drug company which comes in for registration has to have all their details in terms of their processes and all online, which is available for everybody.
Okay.
Every time there is an inspection of, say, their facilities or the raw material testing, the reports of the testing are given, and the person who has done, the lab which has done the testing, and the drug inspector who has signed off on it is given over there. They should be accessible to everybody.
Okay.
So now if a drug company says, I think this is not right, it's all there. So this is the person done, this is the lab which says your work is not adequate or the material is not correct.
Okay.
And it comes in immediately. So one of the things is transparency, because if you look at, say, drug procurement, testing of the drugs, these are all hidden in government documents.
Okay.
If they were easily accessible, while yes, civil society would access them, it would help as a check and balances on the prevention of harm to patients, because immediately they would say, okay, it's been 6 months since they've been tested. Who's the person who's gone? And the names also, because very often, as you see, inspection was done. Who did it?
We don't.
No names. The drug department or the the FDA department did it. Who went there? These things become important. So I think in some cases, as a developing country, where we pride ourselves on being able to work for our people, I think the importance of transparency is essential. I think what gives me deep thought is the fact that not all lives are equal. And I think one of the places where I looked at it was when a prince's life was at risk, people crossed mountains to get Sanjeevani. But every day, tens of thousands of ordinary soldiers died on the battlefield. And yet nobody went to get medicine to revive them. And so I feel that there is a lack of respect for the vast number of human beings in our country who don't have access to media, who don't have a voice, and who have to live with the public health systems, and it is their work, their hard work, their labor, which actually has raised our economy to where it is. It's not the big businessmen or, doctors who do fantastic surgery or all the other entrepreneurs as much as the people whose hard work, manual labor has brought our country up. And I think the need to respect their lives and the care they receive is important.
Okay. Well said. And I think the other thing that adds to it is only when something like this happens, where there is some sort of political movement or blame game that happens, then people suddenly wake up. Otherwise, it wouldn't really matter.
In fact, that's the sad thing, that the political processes which have arisen, opposition against the state against opposition, center, state, all these things actually cover the point that what we want is standard operating processes, effective, transparent systems, irrespective of who's in governance and who are the politicians involved.
As things stand, the Karnataka government has expressed readiness to conduct a judicial probe to bring out the truth. But with the Ballari case exposing systemic failures, stringent monitoring, and transparency in drug testing, as well as a possible legislative reform, seem like the need of the hour. I'll see you in the next episode of Decode Karnataka. Until then, follow The Hindu for more such stories and videos.